Welcome to part 3 about HRT and medications. The reason HRT has been out of favour is due to a study in America in 2002 that showed there was an increase in heart disease, stroke, blood clots and breast cancer taking HRT. The average age of the woman in this section of the study was 63 and many were over 70. And the purpose of the study was to see if HRT could prevent the women getting heart disease. Very strong older hormones were used on these women, and there were indeed increased risks for these women in this age group compared to the average population. However, other arms of the study showed that when a woman started on HRT within 10 years of commencing the menopause, that the benefits of HRT outweighed the risk. However, the media focused on the older age group of women and governments got involved and HRT was dismissed. HRT is not for everybody and each woman should be treated individually. Hormone replacement therapy. This hormone replacement therapy is a treatment to relieve symptoms of the menopause because it replaces the hormones that are getting lower in the woman of menopausal age. Research shows that HRT is the most effective treatment for menopausal symptoms. Now, there's different types of HRT. So if you don't have a uterus, the vast majority of women without a uterus only need to be on estrogen only HRT, that is one hormone, and that comes in a form of either tablets, patches, gel or spray. Now, HRT for women with a uterus, they need to have a combined hormone preparation, that is progesterone and estrogen together. The progesterone gives endometrial protection and the estrogen part of it sorts out the menopausal symptoms. Now, following on from that, women with a uterus also have a choice of having a monthly bleed HRT or a no bleed HRT. Women who are in the perimenopause and are still having periods need to be on a monthly bleed HRT. So if a woman has not had a period for more than 12 months, she can go on to a no bleed HRT if she is over the age of 50. The reason is that if you are still having periods, there is still some ovarian activity going on, and so you need to have a monthly bleed cycle to follow the normal pattern. If you have no periods at all for more than 12 months and you're over the age of 50, a no bleed HRT preparation is allowed, and as long as you don't bleed on that preparation, you can continue on it. But if you get bleeding on it, you need to be investigated for postmenopausal bleeding. There is also another form of combined HRT that can be used, namely a Mirena coil that will be inside the uterus giving endometrial protection, and then you can have estrogen only HRT as shown above in the form of tablets, patches, gel or spray. HRT does not suit a significant percentage of women for many reasons. A woman may not be allowed to take HRT due to a history of blood clots or breast cancer, or she simply doesn't want to take it. People who take HRT, it may cause many problems, such as bleeding issues, things like heavy periods, or it can stimulate uterine fibroids or cause hyperstimulation of the lining of the womb. HRT can also give a huge amount or variety of side effects. So many people ask about alternatives to HRT, and there are many different types. Hormonal medicines use a plant or plant extracts to relieve symptoms, for example, St. John's wort and evening primrose. It is difficult to say how effective these are, as there is no robust research that shows that this medicine you try is any better than taking a placebo. Each woman needs to decide which one she wants to try and what symptoms she wants to resolve. and a trial of 3 months should be used and monitor symptoms. If there's no improvement after 3 months, you should stop it. There are other alternative medicines, such as a range of therapies that can be used instead of conventional medicines such as acupressure, acupuncture and homeopathy. There are complementary therapy interventions that tend to be used alongside conventional medicines such as aromatherapy and HRT. There are also non-hormonal medicine types that can be prescribed by your doctor, such as antidepressants. Remember, all of the medications, both prescribed and bought over the counter, can have side effects and contraindications, so always check them before use. Thank you for listening. Please see the useful web contacts for further information and support.